Our region is justifiably proud of the contribution the healthcare and life sciences sector has made to the transformation of our economy, not to mention our quality of life. Last week, the University of Pittsburgh celebrated the work underway and what's to come as it hosted a Life Sciences Week. According to the Pittsburgh Regional Alliance, with almost $750 million in life sciences research, Pitt alone ranks 7th among U.S. universities. More broadly, more than 132,000 people work in the sector here in our region. It's actually our region's 4th largest industry. So, what could go wrong? Well, a looming shortage of healthcare workers in family medicine, for one. The high cost and burdensome debt associated with getting a medical degree encourages many physicians to opt for specialties rather than family medicine. And that has health and economic consequences for all of us. The Family Medicine Education Consortium is out to encourage more medical students to make a different choice. Dr. Amy Crawford-Faucher is Program Director of the Forbes Family Medicine Residency Program. Larry Bauer is the Chief Executive Officer of the consortium. Good to have you. Welcome.
Thank you.
Good to be here.
Yeah, so you're actually a family medical person, doctor?
I am a family doctor.
Yeah,
Yes, I
really?
am.
How did that happen? What?
Well, you know, my whole life view is pretty broad and generalist, and I couldn't imagine being in a position where I had to restrict my practice to one gender, one age, one disease process. I love seeing everything that comes through the door.
Okay, very, very cool. But not enough of folks like this, Dr. Crawford-Faucher?
Absolutely not.
Yeah.
So the Family Medicine Education Consortium is a not-for-profit that supports family medicine across the northeast region of the country. And we've been working to help the medical schools to understand the need for more family physicians in their respective communities and to address that issue through a variety of strategies. The nation needs more family physicians. More family physicians means better health care, lower cost.
Well, and I hear, and you're the exception, I hear that lots of family docs are all in their 50s or 60s around here. Is that a problem? Are they aging out?
Well, thank you for saying that for the first time. I think that it is, and I think some of the pressures on medical students these days is worse than it was 30 years ago when folks were coming through. You mentioned medical school debt is a big piece of it, and I think that that whole growing idea that if I can be a specialist, if I can be very good at one very narrow niche of medicine, then I can do a better job. And I think that we need to be more visible about really showing students not only can they pay off their debt and have a fine life as a family physician, but also the vast importance of having that generalist approach where you don't know what's coming through the door and it's your job to sleuth it out and determine to help people stay healthier.
Yeah, I remember once when a family member had to have care, and my brother, who is a rocket engineer, said, you know what, in our line of work we have a systems engineer to pull it all together. In healthcare there doesn't seem to be a systems engineer. Sounds like that's a role that family docs play.
Family docs are systems engineers, yep, or quarterbacks, depending on what your analogy is.
Yeah, what kind of team you're putting
together.
What you're really trying to accomplish. But really not enough of them out there? Is this really an issue across the country, not just here in our region?
It is an issue everywhere. Rural communities, urban communities, there aren't enough family physicians graduating from our medical schools. In my opinion, a large part of that has to do with the current admission criteria that many schools have, where they're trying to get people, really not the kind of people who are attracted to the whole person care. And the deans of our medical schools really don't want to take responsibility for that. They're more excited about training the next generation of clinician scientists.
And what about the insurance industry? Do they play a part in this? Pay by the procedure instead of just keeping a patient healthy? I mean, do they have a role to play to make this all work?
So it's been an interesting last 20 to 30 years. The insurance industry decided that they wanted to reduce the cost of care, and they chose to focus on primary care, not only family medicine, general internal medicine, and to a much lesser extent general pediatrics. So they reduced their reimbursement for family physicians for primary care, which has led to the great disparity that happens right now between income level. The other part of that is because we've had a fee for service, the more you do, the more you make system, and not paying for value. They're beginning to talk about that now. But if the goal is to keep people healthy and out of the hospital, if at all possible, and somebody like Dr. Crawford-Faucher can help you to stay out of the hospital, and if you do have a problem, to help you figure out which pieces of the system you really need to use. If you had that, the hospital industry actually would have some problems because they're used to filling their beds, and that's how they make their money.
A lot of conflicting goals and the business models and everything else. A little less than a minute left, but I'm wondering, you had a big conference here last year. It's going to be in Cleveland this year. Do you get a sense you're getting traction, or are people paying attention? Is there more interest in this?
I think that it is. So as a residency director, my main job is training the next generation of family physicians here in Pittsburgh. But a part of that is attracting the best medical students for our program. So I do a lot of work at the medical schools around the Northeast region of the country as well, and making those connections. And I think part of it is they need to see people doing the things that they see themselves doing, and giving them permission to be someone who cares for an individual in the context of their community and their family. It is very important. So maybe I'm biased, I'm on the FMEC board, but I think that we are making a difference. We had, what, 300 students at our conference of the 800 total attendees.
Well, all right,
in
that's
Pittsburgh.
encouraging. It's a good sign. It's important. Dr. Crawford-Faucher, Larry Bauer, both with the Family Medicine Education Consortium. Thank you so much. Good luck with the good work.
Great. Thanks so much for having us.
Yeah, absolutely. Next up, glass is back in a big way this summer at Phipps Conservatory. We'll take you inside the Botanical Gardens' new blockbuster attraction. Stay with us.